Hello everyone and welcome to this channel. In this video, we will talk about the first type of autonomic nervous system drugs, which is the cholinergic agonists. These drugs, they act on cholinergic receptors, which are the receptors that are activated by acetylcholine. Acetylcholine is the primary neurotransmitter of cholinergic neurons. These cholinergic agonists are divided into direct acting and indirect acting. So acetylcholine shows multiple actions because it can bind to both muscarinic and nicotinic receptors, which are the two types of cholinergic receptors. And it is also inactivated rapidly with acetylcholinesterase, which is the enzyme that inactivates acetylcholine. That is why it is not used therapeutically. Some of the effects of acetylcholine includes a decrease in heart rate, cardiac output, as well as blood pressure, due to the activation of M3 receptors that are found on the endothelial cells of blood vessels, which result in the production of nitric oxide and cause vasodilation. Acetylcholine also increases salivary secretions, and it also stimulates the intestinal secretions and motility, and it can enhance the bronchial secretions as well. In the eye, it is involved in the stimulation of ciliary muscle contraction for near vision and the constriction of sphincter muscle, so it can cause miosis, which is the constriction of the pupil. The second direct acting cholinergic agonist is beta-nicole. Beta-nicole lacks nicotinic action, but it has a very strong muscarinic activity because it stimulates the muscarinic receptor, and it causes increase in the intestinal motility and the tone of the intestines. And it can also stimulate the drusal muscle of the bladder. So it is used in the urological treatment to stimulate the atonic bladder, particularly in post-operative operation sessions, and can also used to treat the megacolon, which is abnormal dilation of the colon. The third agent that we will be talking about is carbachol. Carbachol has both muscarinic and nicotinic actions, and because of that, it has ganglionic stimulating activity. It is rarely used therapeutically because it is not non-selective and it has a long duration of action. It is only used as other cholinergic agonist in the eye as a miotic agent to treat glaucoma, which is a condition where there is an increased pressure inside the eyes. The last agent of direct acting cholinergic agonist is pilocarpine, which also has muscarinic activity and also used primarily in the ophthalmology to treat glaucoma. It also used to produce salivation in patients which have dry mouth from irradiation of head or neck, and also in Sjogren syndrome, which is a syndrome that is characterized by dry mouth and lack of tears. Now we will talk about the second type of cholinergic agonist, which is the indirect acting. This type, it is called indirect acting because they inhibit the enzyme acetylcholinesterase, which, as we said before, it cleaves acetylcholine to acetate and choline. So because they inhibit this enzyme, it provides increase in the cholinergic activity. The first agent of this group is edrophonium, which bind is reversible to the active site of acetylcholinesterase. This agent, it is used in to diagnose myasthenia gravis, which is an autoimmune disease. The second agent of this group is physostigmine, which has muscarinic and nicotinic actions. So it increases intestinal and bladder motility, and it can be used in the autonomy of these organs. And it is used in treatment of overdose of anticholinergic effect and drugs like atropine. The next agents are neostigmine and pyridostigmine, which also reversibly inhibit the enzyme acetylcholinesterase, and they can stimulate the bladder and GIT tract, and so they are used antidote for competitive neuromuscular blocking agents, which we will talk about them, and also they can be used to manage the symptoms of myasthenia gravis. The last agent of reversible and acetylcholinesterase inhibitors are the agent that are used for treatment of Alzheimer's disease, which are tacrine, donepezil, rifampicin, and galantamine. Tacrine is not used anymore because of hepatotoxic effect, but the other drugs are used up to now. Now we will talk about Echothiophate, which is an irreversible acetylcholinesterase inhibitor because it covalently binds to the active site of the enzyme, and it causes generalized cholinergic stimulation, so that's why it is rarely used due to their side effect, like a very intense meiosis and the risk of causing cataracts. So these anticholinesterase agents are commonly used as agricultural insecticide in the US, which has led to numerous cases of accidental poisoning. In addition, they are frequently used for suicidal and homicidal purposes. So if there is a poison with this agent, there is a drug that can reverse the effect, the inhibition of acetylcholinesterase, which is called pralidoxime. This drug, it can reactivate inhibited acetylcholinesterase enzyme, but it can only inhibit the effect of the irreversible acetylcholinesterase inhibitor, which is the echothiophate. Like, it will not inhibit the effect of the reversible ones that we have talked about, like physostigmine and neostigmine. Other medications that can be used for this poisoning is atropine, which is the most potent anticholinergic medication, and it can prevent the muscarinic side effects of those agents. Thank you for watching. Please don't forget to subscribe.